Good evening, everyone. Thank you for taking your time in joining us here tonight. And on behalf of ECA, College of Health Sciences, I extend a warm welcome to all of you. I will be your host for our webinar tonight. My name is Stephanie, Student Recruitment Consultant for ECA Online Higher Education. And I have been in the education industry for the past 4 years and with ECA for the past 12 months, helping students achieve their goals and aspirations. So, tonight we will discuss the courses that we offer and its career opportunities waiting for our aspiring students. And throughout this webinar, we will also go through into the details of health management course, discussing the course structure, online delivery, career opportunities, dean scholarships and fee help, of course, our promotion, admission requirements, and student support. And of course, why you should choose ECA, College of Health Sciences. Okay, and to start, let me give you a brief background as well of ECA College of Health Sciences. We are a private higher education provider delivering high quality education programs that prepare students for enhanced professional practice and leadership in their field while engendering lifelong learning and strong ethics. And of course, our speaker tonight is one of the professors of ECA, College of Health Sciences. So this will be a great opportunity for everyone to ask questions. But before I introduce our speaker, let me also introduce our dean first. It is my honor to introduce our academic dean, Associate Professor Michelle Cavallari, is the academic dean at ECA Higher Education. With the expertise in course design, student support, and staff development, Associate Professor Cavallari works with faculty to enhance the student experience and improve learning outcomes. Associate Professor Cavallari has a background in languages, linguistics, and TESOL, and she has taught in undergraduate and postgraduate courses and work in specialist academic support roles. Associate Professor Cavallari's teaching experience ignited her interest in feedback and academic writing development, which led her to PhD research examining technology mediated feedback. Associate Professor Cavallari has presented her research at national and international conferences and is regularly invited to facilitate faculty development sessions at higher education institutions. All right, and now it is a privilege as well to have our course coordinator as our speaker tonight to give us a better understanding of the health management courses. Please let me help me welcome Dr. Mohamed Khalifa.
Thank you very much, Stephanie, for this nice introduction. I can introduce myself. My name is Mohammed. I'm the Director of Studies for the College of Health Sciences now for more than 3 years. And I am also the course coordinator for the program itself, the Master of Health Management. My background is medicine. I'm a medical doctor by training, and I did my master's at the University of Edinburgh in Scotland, and I did my PhD at Macquarie University. And during the last maybe 10 or 12 years, I have published almost 70 papers, 70 journal papers, and book chapters on digital health, health informatics, health management strategy in healthcare, healthcare improvement, quality, and patient safety, and other domains that I will be also having the privilege to teach you some of these topics. So I can go to the next slide, Stephanie, if you would like.
Yep.
Yes, so the program itself, which we are talking about today, is the Master of Health Management. It's a 12 units program designed into 3 levels of nested courses. So once you, as a student, can complete your first 3 units, some students would prefer to exit and graduate from the program with a graduate certificate in health management. And when students complete the next 3 units, a total of 6 units, they can exit and graduate with a graduate diploma in health management. And for those students who will complete the whole 12 units, they can definitely graduate with the Master of Health Management. So these are the two exit points after 3 units and after 6 units. We have also some students enrolled into the graduate certificate. And when they complete the graduate certificate, they have the option to progress into the graduate diploma or the Master of Health Management based on their success in passing the first 3 units. Some other students could be enrolled from the start, from the beginning in the graduate diploma, and other students could be enrolled from the beginning in the master's. So at the end, these are the three nested levels or courses together. Now, next slide will show us the different topics or what we call the units of study. For example, the first unit is about the Australian healthcare system and the different contemporary challenges. The second unit is about clinical governance, safety, and improving quality in healthcare. The third unit is about leadership and management. These are the first 3 units for the graduate certificate. And then to complete the graduate diploma, the students have to study unit 4, 5, and 6. Unit 4 is about evidence-based practice in healthcare. Unit 5 is about health information and information management and technology in healthcare. Unit 6 is about leadership in the practice of health management. And then unit 7, 8, 9, 10, 11 to complete the masters. So unit 7 is about change management. Unit 8 is about strategic and organizational planning. Unit 9 is about the statistics and epidemiology and critical analysis, and unit 10 about the health, finance, and economics. And then the last unit, unit 11, which is a double unit. It is equivalent of 2 units. It's a capstone project unit. Now, let's go to the next slide. So the next slide here shows the graduate certificate with the first 3 units, unit 1, 2, and 3, and the graduate diploma with the first 6 units, 1 to unit 6. Now, so technically, students usually finish for the online cohort because we have international students studying on campus face to face. We have domestic students mostly studying online. And the online, of course, give us like more flexibility for studying and saves time and so on. And we will come to the advantages of this mode of study. Now, for the masters, let's go to the next slide, I think. Yes. Okay. I just want to mention that the master's is different from the certificate and the diploma, mainly because of the capstone project, which is unit 11. Yes, thank you. So unit 11, the capstone project, is a research-based unit where you will be experiencing interaction with industry, networking, visiting, for example, if you when you have time, if you choose to do so, you can visit one of the facilities that we are trying to introduce some of the visits. This could be implemented from end of next year, which is before you reach to that unit. Some students could choose to do a systematic review, a form of research. Then this is going to be a group work where you will be examining the literature to write about overcoming challenges in healthcare, inventing new techniques or technologies, evaluating technologies, evaluating patient safety, designing a new framework, for example, to improve patient safety or improve the performance of different healthcare services and so on. So this is the capstone project, which is the last unit of the master's. Now let's go to the next slide and then the next one. We will go a little bit deeper into one of the units, which is unit 2. This is the governance, clinical governance, safety, and quality in healthcare. You will be starting your master's with this unit, studying this unit online. And by the way, our trimester starts Monday, the 30th of September this month. So in less than 3 weeks from now, 2 weeks and a half from now, we will be starting our studies. Now, this unit, for example, covers the organizational learning of healthcare institutions. It covers also the leadership in the area of quality. It covers clinical governance and what clinical governance means, and the continuous improvement of quality and performance of healthcare safe services, in addition to patient safety and improving the culture of safety in healthcare organizations in different levels of healthcare organizations, including primary, secondary, and tertiary. This unit as well is focused on how to receive different types of incidents, report these incidents, analyze the incidents to learn from the errors, mistakes, challenges, and so on. We will also learn a little bit about developing KPIs to measure the quality in hospitals. And then we will study that in more details in Unit 5, Information Management and Technology in Healthcare. And we will have more deeper understanding of the statistical analysis of health services in Unit 9, which is going to be next year. Now we can go to the next slide. Now, completing the health management qualification, the graduates will gain a core knowledge and improved and advanced perspectives in addition to skills and abilities in main areas such as the structure and complexity of healthcare systems, social care systems, clinical governance, patient safety, and quality improvement in healthcare, in addition to leadership, management, health informatics, technology, epidemiology, statistics, evidence-based practice, and so on. The graduates will also understand some advanced skills, mainly related to implementing evidence in practice through evidence-based practice, of course, understanding and extracting knowledge from publications, studies, which is the evidence, working on change management, in implementing new approaches, strategic planning, planning for healthcare workforce, finance and economics, epidemiology, statistics, and critical analysis, in addition to research. Upon successful completion, this qualification prepares the graduates for managerial and more leadership roles in variety of fields. These fields could be hospitals, private centers, clinics, community health centers, aged care services, health planning, government agencies, and different types of social services as well related to healthcare. Okay, next slide, Stephanie. I think it's your yes, we will talk now about the online study compared to the face-to-face or on campus. Usually we receive between 70 to 80 students each enrollment, each intake. For the face-to-face, most of them come from international overseas. And we usually receive between 15 and 20 students for the online, the domestic students studying online. Attendance is very important face to face. However, we also have the Zoom sessions for the online. You can join and you can attend these sessions. Usually for each unit, have like 2 hours of a lecture and a workshop together. So in the workshop, we can implement the activities and the discussions that we should be learning through, implementing what we have learned during the sessions, plus the resources on Canvas. Now, we have an online learning system called Canvas. So the Canvas is similar to Moodle, is similar to Blackboard. All of these are online learning systems, or let's call them learning management systems. These learning management systems allows you to access them using a username and password, and then you can watch the lectures recorded, download the slides, download extra readings, click on the links, watch videos, and you can interact with one another. You can also send messages and emails to the course coordinator, to the director of studies, myself, to the lecturers, and you can even share your thoughts through the discussion boards and so on. So this is the offline part. So the offline part is the learning management system, the Canvas learning management system. And you should, before your enrollment, 1 week before the start of study, you should receive your username and password and email. So your email will be your ID at students.chs.edu.au. So this is your formal college email through which you can use it to send emails and receive emails, but also could use it to access the Canvas learning management system. Now, in addition to the offline learning, which is accessing Canvas, watching the videos, watching the recording, downloading the slides, in addition to that, you will be attending a weekly session for 2 hours in the evening from 7 to 9 p.m. And Unit 2 will be Mondays. So our first session is going to be Monday, the 30th of September from 7 p.m. to 9 p.m. You will receive the Zoom link to the meeting, to the session, and then we will start from there. We will go through the materials, we will go through Canvas, the different functions in the first week, and also I will show you the different resources because we have a wealth of resources about academic writing and academic performance, how to pass the units, how to do your assignments, how to excel in writing academic assignments, and so on. So this will be very helpful for you. So please put all your effort and dedicate some time to attend these weekly 2 hours session. Now, in addition to that, you need every week you need to prepare for the next session. So that please come to the session itself prepared after reading and having a good look on the lecture itself and the unit. The weekly, we call them modules. So module 1 is week 1, module 2 is week 2, and so on. So this trimester extends over 12 weeks from the 30th of September until before Christmas, maybe the 20th or the 21st of December in this year. So during these 12 weeks, you will be able to um, access the resources, study your topics, and participate and attend your online sessions. Each unit, like Unit 2, for example, it has a group of assessments or what we call assignments. So we don't have exams, but we have assignments. So to do an assignment, the assignment is a piece of academic writing that could be 1,000 words, 2,000 words, 2,500 based on the description and objectives and learning outcomes of the unit and the program or the course. So we will learn more about these when we join the first session. We will go over the 3 assignments. We have 3 assignments for Unit 2. Each assignment has a due date, and you have to be very careful about the due dates. And the due dates allows you to submit before the due date. So you are allowed to submit 1 week, 1 day, 2 days, 5 days, whatever, before the due date. Any submission that is after the due date is considered as a late submission, and there are certain penalties like marks deduction if you submitted late. You also will be learning more about similarities and academic writing and plagiarism. What do these terms mean and why it's very important to protect the academic integrity of the academic writing so that you don't copy from resources, you don't copy from websites, you don't copy from other students. Otherwise, the system, the Turnitin system, will identify these copied material. All of that aims at improving your ability to brainstorm, to think, to plan, to write, and to learn from what you are studying, rather than just copying from a paper or from a website. You have to write it in your own language, and we will come to that in more details. This also will make you, as a graduate, prepared for the job as a health manager rather than as a doctor or a nurse. As a clinician, no, you will become a health manager based on that level of knowledge and skills. Next slide, Stephanie. Thank you. So, what are the benefits of the online? Now, online seems for many people sometimes more enjoyable, but sometimes more challenging. It provides better work-life balance better flexibility because you can attend the session on your convenient time, convenient place, while you are at home, while in a break between doing something and another task. You have free access to all ECA online short courses. It has the same recognition of the face to face on campus, the same registration, the same recognition as a master degree, a higher education degree. In addition to that, you don't have to travel from your location to the campus every 2 days or every 3 days because we have usually teaching 2 to 3 days a week. It's cost saving and make it more affordable to save the time and effort and money to travel and do all of these things. Attendance on the sessions is very important, to be honest. I haven't seen anyone who is attending all the sessions and then fail any unit. So attendance is very important. It's not mandatory in terms of marks, but it is mandatory in terms of achieving at least 75% of attendance of the sessions, unless you have a medical reason, an excuse, or some circumstances that you should be telling us about in details. Next slide.
Oh, I think this one
I
is.
think that's all for me. Yeah, thank you very much, Stephanie. Thank you very
Thank you
much.
so
That's all
much.
for me. Now to you back again, Stephanie. Thank you.
Thank you so much, Dr. Mohammed, for the very detailed explanation. Now, everyone has an idea of how does online learning works
Yes.
compared to campus, right? So, of course, everyone would like to know the fees and what are the scholarships available and promotion. So, ECA, College of Health Sciences, is offering limited scholarship for our eligible domestic students. And I am very excited to introduce you to the Dean Scholarship that we provide, specifically designed for our Master of Health Management program. This is more than just financial support, it's also a gateway to unlocking new possibilities in your career. Now, here's the thing, these scholarships are just limited and highly competitive. So, we will only select a few that will be awarded. But if you're passionate about making difference in the health sector and have the drive to succeed, this could be your chance. Of course, ECA College of Health Sciences is also a registered fee health provider. Australian citizens have the option to apply for a government loan funding to cover their tuition fees. Now, here's how it operates. During the application process, you'll complete an electronic Commonwealth Assistance Form, or we call it ECAF, to apply for the government loan funding. Now, typically, repayments income based and commences when your salary exceeds the fee help income threshold. Fee help is applied when you enrolled in a subject. So, for example, the Master of Health Management has a 12 units. You register to enroll to commence a subject. Now, the subject fee with the scholarship is 1,900. Without the scholarship fee, it's 2,600. Now, the fee help will be applied through that. Students also have the option to choose to enroll in additional subjects such as the second or third subjects depending on your preferred pace. For more information, you may visit the website studyassist.gov.au. All right, so students who will enroll for our upcoming intake will receive a 12-month free complimentary subscriptions to ECA Online Skill Builder short courses and Employability Advantage. ECA Online Skill Builder short courses are the great way as well to enhance soft skills needed in a professional environment. Complete short courses in leadership, interpersonal skills, and creative problem solving. Of course, we also offer employability advantage. These are essential tools and resources to help students launch their career and gain confidence and skills needed to succeed in the professional world. I would also like to go through our student support. So, aside from our professors, of course, Dr. Muhammad and the professors, and you have me as well. Okay. In addition to that, We also have dedicated and accommodating student support team ready to assist you. At ECA College of Health Sciences, student learning support is a priority to ensure that every student has a smooth and enriching learning experience. So going back, now we'll go through the intake. We're excited to announce that the intake for this course is scheduled for coming September 30th. 2024. However, please note that the cutoff date for applications is only until September 27th, 2024. Now, this isn't just another intake. This will be the final opportunity to enroll in the Master of Health Management program this year. If you miss the chance, you have to wait until 2025 to begin your studies. And we all know how precious time is, especially in a fast-growing field like health management. Before we proceed into the Q&A session, let us just quickly go through the admission requirements of the health management courses. So for our Master of Health, these are the following requirements. If you have a bachelor degree equivalent to AQF7 or higher in the health related discipline. Alternatively, we also accept if you have minimum 3 years relevant working experience in health related field. The relevant work experience must be demonstrated through a CV and a statement of service, confirming the dates and employment and the position held within the organization. And for our graduate diploma in health management, again, if you have bachelor's degree equivalent to AQF7 or higher in health related discipline. Alternatively, if you have a minimum of 2 years relevant working experience in health related industry, the relevant working experience must be demonstrated through a CV and a statement of service confirming the dates and employment and the position held within the organization. Now, same goes with our graduate certificate, just like the graduate diploma, if you have bachelor's degree as well, or higher qualification in the related health field, or if you have minimum 2 years working experience in the health industry. Thank you so much. And of course, if you have not submitted your documents yet, I have flashed all my details on the screen. So this is my direct mobile number, my WhatsApp, and this is my email. If you have further questions, feel free to message me or call me. Thank you so much, Dr. Mohammed, for being here tonight. Thank you,
It's my
everyone.
pleasure. Thank you. Thank
Thank
you.
you so
See you.
much.
See you.